I'm Dr. Chandrima Jot Roy. I'll be speaking on pelvic pain today. Pelvic pain can be two types. One is the periodic pain that you have during your periods, and the other is otherwise. Now, the periodic pain that I'm talking about, we refer to it as dysmenorrhea, and it is of two types again. One is the primary dysmenorrhea, and the other is the secondary dysmenorrhea. Now, the pain that occurs in young unmarried girls immediately after, not immediately, but 1 or 2 years after they start their periods, they have this pain during their periods, but that only occurs during the first day and only after the periods start. And usually it stays for a few hours and then it goes off. So this is primary dysmenorrhea. But this dysmenorrhea also can be sometimes very intense, and then the person may need some medication, maybe a small medication just for the few hours, and then she should be okay. And the next pelvic type of periodic pain is the secondary dysmenorrhea. Now, this secondary dysmenorrhea, it usually occurs in women during their reproductive years, and usually after they start their sexual life. Now, this pain usually it can occur in young women also, and even if they have not started their sexual life. Now, this type of pain, what happens is that this is called secondary dysmenorrhea. The pain will start a few days prior to the periods, and then on the day of the first day of the period, there will be a lot of pain, and sometimes it may stop on the first day itself, and sometimes it may continue even into the second day and even the third day of the periods. Now, this type of pain you should not neglect. It indicates that there is a pathology, and the pathology is most probably it might be a pelvic infection, and it might be another disease called pelvic endometriosis. Now, in pelvic infection, if you go to the doctor, then she'll give you some antibiotics, maybe some anti-inflammatory, and then maybe your pain during the periods will stop. But if it persists even after that, then maybe it might be the first stage of endometriosis. And endometriosis, you must be aware, it is a progressive disease. Once it starts, it goes on and on. Because you see, in endometriosis, what happens is that the endometrium, instead of being inside lining the uterus, it is within the pelvis, sometimes on the ovaries, and even in the pelvic peritoneum itself. And here what happens, every time you have your periods, there's a little bit of bleeding, and then it stops, it gets fibrosed, organized, and then again the next period comes, again it collects. And in this way what happens, that blood will collect, and slowly you get small cysts, and from the small cysts then you'll get into a big cyst, and that is what we call chocolate cyst of the ovaries. Now, this disease, as it goes on, it becomes quite distressing to the patient itself, and the pelvic anatomy also gets distorted. So you cannot neglect this condition. You have to get it treated as fast as you can and as early as it is diagnosed. So you have to be aware of pelvic pain and report to the doctor as early as possible.